Hello, I'm Dr. Philip Coslow. I'm a biologic dentist in Dallas, Texas. And I've made some videos that have to do with different issues, different questions that we get in my practice all the time. This video is going to deal with a little bit with new technology. This is a great time for patients and for dentists. We've got new procedures, gum disease. We now treat gum disease non-surgically, which is a big plus for patients. We have digital x-rays. They use very little bit of radiation. We've got another device that's relatively new that if I have a question about a tooth, if it maybe looks like it might have a little decay in between the teeth, that kind of thing, I can use this instrument. It does not use radiation. It uses a light source, and it will tell me if there's decay in that tooth. Great deal. We have something called a CAD/CAM, which is computer-aided design, computer-aided manufacture. When we have to do a crown, and we don't do many crowns in this practice at all, most of our crowns are what we call half crowns. This device allows me to scan it, make a video of your teeth. The computer designs the restoration. It mills it out for us. We try it in, make sure it looks good, it fits well, that sort of thing. We put it in a porcelain oven, run it up to about 1300 degrees, let it cool down next time before we put it in. We put it in, we bond it in, done deal, no temporary, no goop in your mouth and all that kind of stuff. That's a big plus. The reason why we don't have to do full crowns is this material is so biocompatible that this CAD/CAM uses, that it bonds so well that we don't have to reduce all that tooth structure, take away all that tooth. We get to save a lot of tooth. And that's a big plus for you because it's healthier for the tooth, healthier for the gum, a lot easier to keep it clean. And they're beautiful. They're beautiful restorations. They look just like teeth. You can't tell. There's a lot of things that Invisalign that we've been using now for a while. That's a great way to straighten teeth. It's comfortable. You can take the aligners out when you eat, brush and floss. You put them back in again. It actually is, I think, many times more efficient movement of teeth because it grabs so much more of a tooth than the little button does on bands and brackets and wires. There are procedures out. Like I say, we don't do any surgery in gum disease anymore. The fillings we do, we keep small. We use materials that are biocompatible. They bond well. Anyway, it's a great time, like I say, for patients and for dentists alike. And by the way, if y'all have any daughters, sons that have interest in science and the healing arts, have them look at dentistry. It's a great profession. And I always like to see young folks come through and they'll visit with us a day or two or sometimes a week. They'll follow us around, and I really encourage them to do that with their dentists. So appreciate you watching. I'm Dr. Philip Coslow, biologic dentist in Dallas, Texas. My website is dallasdentist.net. Thanks for watching, and you might check out some of our other videos too. Bye-bye.